All right, I think we're going to get started, guys, because it seems like we've stopped moving in the number of participants. So if anybody joins us last minute, that's okay. I think the bulk of us are here today. So just wanted to welcome you and say thank you for joining our webinar. We're really excited to be hosting 2 webinars this week coming up in PEI with Hospice PEI. And so, yeah, today we're going to look at, enabling Canadians to support caregivers through strengthening those care connections. So I, and along with Nancy Marie Arsenal, will be sort of working together on this slide deck today. So just a little bit about the Pallium Echo project, whose this webinar is bringing. We're able to do this because of this project. So the Palliative Echo project is a 5-year national initiative to cultivate. Let me go back. Okay. To cultivate communities of practice and establish continuous personal development among healthcare professionals across Canada and also community members like yourself, so that we can care for patients who are on that life-limiting illness journey, including caregivers and people who are dealing with grief. So just a little bit about, some of our funders who are helping bring this webinar to you today. So our Palliative Care Echo project is funded by Health Canada, so we would just like to acknowledge their contribution. And then this webinar is also funded by the Joan and Regis Duffy Foundation locally in PEI. They really want to support and spread the Care Connections program. So they've been great in helping with this webinar today, funding this webinar, and then the one that will be coming up on Friday. And if you're not aware about the Friday one, don't worry about it. We will highlight it quick near the end of the presentation. So just want to say thank you to both of those organizations. Disclosure-wise, Pallium is a not-for-profit, and we are partially funded by Health Canada. We also do generate some of our own funding through, our healthcare courses and some of our products like our Pallium Pocketbook. Okay, so as I sort of alluded to at the start, presenter-wise, I will be one of them. So my name is Bonnie Tompkins. I do work at Pallium Canada, and I'm the Compassionate Communities National Lead. So it's my job to basically work at increasing the capacity of the community to support caregivers or people who are on that palliative care journey, dealing with grief. So I'm really focused on that community side. And then we also have Nancy Marie Arsenal here, the Executive Director from Hospice PEI. So you will hear from her a little bit today, and then as well again on Friday. And we have some great support staff here as well from who are supporting us in the background from the Echo project. So if you do have any questions, please feel free to, in the chat, leave a message and they will try and help you out. So just wanted to take a minute, as I'll be the main presenter today, to do my, just to acknowledge, that we are on unceded territories in Canada. And so I'm presently in the city of Ottawa today. I do move around a little bit. So I just would like to, acknowledge the traditional unceded territories of the Algonquin Anuwashbe people. And I'd also like to recognize where I'm from, which is actually New Brunswick. And so that territory is the Wabanaki people. So, and just a few little welcome and reminders. So, feel free to introduce yourself in the chat. We'd love to hear a little bit about you and why you're here today. Your microphones are muted, as I'm sure you recognize. And so there will be a Q&A discussion at the end, and we will use that Q&A function to ask those questions. So you do have that in your bar that's available to you in Zoom. Really use the chat functions to have a chat, or like I mentioned, if you're having any technical problems, Aaliyah and Diana are here to help out with that. So the sessions will be recorded and they will be sent to you guys within the next week. So you'll get the recording and I do believe a copy of the PowerPoint deck. And just, when we're having our chats, or if you're doing posting a question, we do encourage you not to disclose any personal health information during the session, because it will be public, right? Okay, so the learning objectives for today is really about understanding the importance of social connection. And you may, if you're here from another organization that's doing support work in the community, this may resonate and make sense to you, but we're really learning more and more that the social connection piece is very important and it really impacts our health. So we're going to look at that a bit today. And then understand how increasing those social connections will support caregivers. So decrease the stress that they're feeling. And then just the awareness of resources that exist to strengthen those social connections. And that's really what we're going to look at today, is that Care Connections program, which is solely designed to help increase the people's sense of feeling connected socially. So just a little bit about Pallium. So Pallium is a not-for-profit. We were founded in 2000 and focused on building capacity. In the early days, it was focused on building capacity within healthcare professionals because they weren't necessarily getting a lot of education. So really focused more on physicians and nurses, increasing their knowledge around palliative care, supporting people who are dealing with a serious or terminal illness, and then caregiving, and then supporting them after as well when they're grieving. Then, because Pallium's goal is to really create system change, we started to work at engaging other key areas to create that system change. So community is one of them. And so a lot of the stuff that we're doing today has really been designed to help us work closer to creating that system change. And then there's also healthcare organizations. So we do have some knowledge education that we do with, say, leaders in hospitals or key leaders within the field, so that they're getting to understand what the palliative care approach is and why we need to support caregivers and why we need to talk about grief. So that's how we're trying to work together to really create that system change. And then, we do a lot of research. So, and we're trying to publish that as quickly as possible so other people can build on the knowledge that we're learning. So I'm just going to pass it over to Nancy Marie, just so she can sort of share with you guys a little bit about hospice PEI, just in case you haven't come across them yet.
Hi, I'm back. I'm here. Sometimes my laptop lags. So, hi, I'm Nancy Marie, the Executive Director of Hospice PEI. I'm recognizing a lot of names in the chat. So thank you so much for joining us. So Hospice PEI is a provincial organization. We are one of 3 hospice service programs on PEI. We are the provincial organization, along with offering hospice supports to those who are living with a life-limiting illness or a chronic end-stage condition. We offer a fairly robust program with grief supports, and most recently, within the past year, have launched our caregiver support program specific to paid caregivers who are supporting somebody with chronic end-stage palliative or a life-limiting illness. So I encourage you to check out our website and follow us on Facebook. You'll see all what is happening within the organization.
Great, thank you. Okay, so let's have a peek at the agenda just so you have a sense of what we're going to cover today. So we are going to present the research that exists around the importance of social connections. And then from there, we are going to look at the Care Connections program. So this is our overarching program that has a bunch of resources in it that are going to strengthen those care connections. So we're going to explore that program, and then the main tool that we're using in that program, which is the Atlas CareMap tool. And I'll just sort of mention this Friday, we're going to have a workshop. Nancy Marie and myself will guide you guys through building your own care map. So if you haven't heard about the Friday workshop, again, we will mention it at the end. And then we're just going to sort of look at, all these different resources, like who should use them, how should they engage with them, what can they do with the content. And then, and then we'll have a little discussion period. So first question, which I was just sort of scanning the chat quickly. We're going to do a little poll here. We'd just like to get a sense of who you are and, you know, where you're coming from today. Perfect. So I think the poll's been launched. Thank you for the help with that because I can't do it. So if everybody could just let me know, are you here for yourself? You're a caregiver. Maybe you're a neighbor or a friend or a family member who wants to support a caregiver around them, or are you in a professional role? So maybe attached to an organization or a healthcare professional. Okay, I think we're done because, oh, one more just snuck in there. I think we can share the results. Let's share the results so everybody can see them. So many of the people here today are from an organization, and as mentioned, I was just sort of scanning the chat and saw, you know, where people are from and some really great, you know, I saw Alzheimer's Society and things like that. So that's really great. We do have one caregiver here today, someone who does want to support a caregiver, which is great as well. And then we have two others. So the two others, if you feel like sort of mentioning, you know, why you selected other, that would be really great because we always find it interesting to learn where everybody's come from. All right, so we're going to move along. Okay, so let's look at the importance of those care connections. What's the impact on people's health? So if you have an exposure to Pallium, you may have seen this before, but this is based on research. So in the last year of life, a patient and the caregiver interact with healthcare roughly about 20% of the time. So the care that's provided, 20% of it comes from the healthcare field. And you can see here the list is quite long: social workers, paramedics, nurse, pharmacists, family doctors. So it's really not just, say, oncologist or the specialist physician. We really are looking at it a bit more broadly. So it's only 20% of that. So when you think about that, if we just look at the last year of life, you know, 80% of the care is provided by who? I think we all know the answer. It's most likely the bulk of it is by the caregiver. And so this research for Pallium has really stood out because it sort of drives our community side, because we see here by this diagram, if we can start getting other key people or key settings supporting caregivers, or creating an environment that's a bit more supportive for caregivers, then it will, that 80% care will spread out, right? So if we can get neighbors getting involved and we can get workplaces, you know, to be more supportive of a working caregiver, things like that, it just will lighten the load for them. So that's, you know, for us, that's what this is all about: engaging other people and having them help out with care in some fashion. So this is some interesting research that has come out, and there's more being done in this field, but sort of looking at social relationships and what's the impact on health. And so what you can see here is the first three are looking at social relationships. And so, and then the rest are like smoking, right? Stop smoking, alcohol consumption, getting your flu vaccines, cardiac rehab, so physical activity. So the idea here is, if you were to make a positive change, say you stopped smoking or you reduced your alcohol consumption or you became more active, what's the overall impact on your health? And so the impact is actually lower for these. So what they're saying here for the first three socials is that doing, you know, making more social connections actually has a greater impact on your health than reducing the number of cigarettes or stopping smoking or reducing your alcohol consumption, or becoming more active. So that for us is really quite striking, because social connections, you know, is an area people haven't really thought about, but clearly it does have a large impact on health. So we have to think about when we want people to be healthy and have a good quality of life, we have to include that piece around, are they isolated? Are they connected? Are they getting the mental and physical support that they need? And again, that's why this program has existed. Just another example looking at cognitive decline here. So people with low social impact, they weren't really interacting versus frequent. They had a higher decline than people who were having social engagement, right? So here's 100%. So again, it just resonates over 12 years. If you, became socially isolated, you would have seen more of a cognitive decline. So you see the diagram here again. And so going back to the diagram in that 80%, this is again where Pallium really feels that if we can engage other people, key settings to help support the caregiver, that social interaction. Maybe it allows that caregiver to go out and do yoga or have tea with her friends if someone can, spell her off at home kind of thing. So really looking at how can we build that social connection, which also leaves them feeling supported, which is good for their mental health as well. And so, Pallium very much believes like friends and neighbors, workplaces, faith communities, your local community centers, anything really can play a role here. We all have a role to play in supporting that caregiver and the patient. So we're going to dive into the Care Connections program now, and you'll sort of see an example of how we are hoping to fill in more of this 80% here by people engaging with the program. So let's have a peek. So the purpose of the Care Connection program really is support caregivers, right? Support caregivers and create an environment around them that is more connected and supportive. That's the ultimate goal of the Care Connections program. And the idea that every Canadian can engage with this content, and you'll see that towards the end. So that ultimately leading to a more supportive environment for the caregiver and patient. What's included in the program? So the program has a suite of free resources and activities, which we're going to look at today, so that, again, anybody can engage and support and create that more supportive environment for the caregiver. So who's the target audience for the Care Connections program? Certainly caregivers. One of the resources is targeted for caregivers, but after that, it's really, again, it's the people around them, right? So we're looking at family, friends, we're looking at healthcare professionals. And then secondary, there's a role here for the community, right? Disease-specific organizations, if there's a caregiving organization, employers can also get engaged. Really, at the end of the day, it's anyone who wants to support a caregiver. They can get engaged in this content. So what are the resources within the Care Connection program? So first we have the Atlas CareMap toolkit. We're going to look at the Atlas CareMap in a bit more detail in a few minutes. And this toolkit is focused specifically for caregivers. It helps them build their care map. The second one is the Community Workshop Toolkit. So this one's designed for anyone who wants to increase the awareness and the ability to build care maps in their community. So again, maybe it's a community center, maybe it's a disease-specific organization, maybe it's the hospice, right? It could be a faith community who says, we're going to run these care map workshops to teach people how to build care maps. And all this content is free, so you're not having to pay to access it. Another one is social connections and palliative care. So that's a free module for healthcare professionals so that they can learn about what are the benefits of Atlas CareMaps. How can I use it in my practice? They'll even get to build their own care map, just so they get a bit of an understanding of what it's like in the process. And then, we give them ideas on how to use it in their practice as well. And then last is Leap Care. So that is an online module for caregivers. So now we're going to have a closer look at all of this stuff. So the Atlas CareMap, as I mentioned, it's sort of the main resource, the underpinning, so to speak, resource within the Care Connections program. So here's the care map. So what is it? The care map is basically, it allows you to create a simple visual diagram of the people involved in providing care. So a caregiver or like maybe a friend would help sit down with the caregiver and help them create their care map. And these maps can get quite big if there's a lot of people involved. And it's not necessarily, it's really not focused on the clinical side. It's really focused on what's happening at home, in day-to-day life. There may be some clinical in there, like a physician or what have you, but the bulk of it is really like who's taking care of the cat and, you know, who's walking the dog and things like that. So it's really more about the day-to-day life at home. And really what the research has found is that it increases the understanding of the caregiver experience and even for a caregiver. I was a caregiver for 5 years, so I can say this confidently. Sometimes we're very focused and we don't really have a chance to sort of take stock of all the stuff that's going on around us. And so what they found was when caregivers sort of built their map, they could see, okay, like, wow, there's a lot more people supporting us than I really thought that there was, right? And that in itself, all of a sudden, the caregiver feels a little bit more supported. But then it also allows them to strengthen their support network. And we'll look at that in a few minutes. Allows you to organize care tasks and activities. So say Claire is looking after the cat, as we see here. Maybe Claire's going on holidays for a week, but you can see other people on your map. So you could just reach out to them and say, like, could you look after the cat from this day to this day because the person who's been helping me is on vacation, right? So it just sort of makes it easier to manage that stuff. And then it can also highlight areas for additional support as well. So strengthening that support network. And as I mentioned, this really is the essential tool within the Care Connections program. So once you create your map, you really put it to work once it's created. And they do recommend creating it certainly for the first time by hand, just with a pencil and paper. You can create it online, and you guys will learn about that if you attend the Friday workshop. But the first time, we always encourage pen and paper. And then, yeah, you may update it again in say 3 or 4 months as maybe the journey is starting to change a little bit so that you can be sure to capture everything. So once the care map is created, the next sort of thing that we encourage the caregiver and say if the friend who's helping them, we encourage them to do is create a wish list. Literally, you would find a space on your piece of paper, write wish list, and think about what are the things that you would love support with, right? So maybe you stop going to yoga, but it's really good for your mental health. So maybe you write down like attend yoga on Friday. And so that list, all of a sudden, when you start sharing it, so that's sort of the next phase, is you share it with everybody. You have that piece of paper, maybe you take a picture with your phone and you carry it with you. And so you show your family and you show your friends and you show your healthcare professional and your neighbors, anybody, you know, who's asking how things are going. Then all of a sudden the caregiver has a map which has a wish list on there of support that they would like. And it really deals with the barrier that exists around accepting and offering help. So all of a sudden you may maybe have a neighbor who comes over for tea and says, oh, you know, is there anything I can help with? And if you're showing them your map, all of a sudden they go, oh, you know what, I can walk the dog. Like I see that on your wish list, just put my name beside that. I can do that, easy peasy. So that's sort of the other benefit of really sharing that map is it gives certainly family and your healthcare professional better understanding of what's going on. And then at the same time, it also allows people who want to offer help clear ideas on the kind of help that would be needed. So just a little background information. So the Care Map is actually built out of the US off of research by the Atlas of Care in the United States. So they started their research project back in 2015. They first piloted the tool in Santa Barbara, and they just had really positive feedback from the participants around creating that map. And basically they heard much of what I shared with you guys, the idea that all of a sudden they saw a visual of what their care network looked like, who was involved. And often they realize, wow, there's more people involved than I realized. So basically, we've worked with Atlas of Care to really take their great resource and adapt it for the Canadian context, and then added a lot more content to scale and spread it. So a lot of these resources are free, and that's sort of a part of our contribution to be able to share that across Canada. Okay, so one of the other programs that's within the Care Connections program is the Leap Carers module. And this one really is ideally more for caregivers themselves. So it's a free online course for caregivers and or anyone who wants to support a caregiver. So if you're a family, or maybe you're like a best friend, you really want to understand what that person's going through, you could take the course, right? Or you wanted to support them better. So yes, it targets caregivers, but there is an opportunity there if you're close and you want to support. So a little bit about the course itself, or the module, I guess, is that it is self-paced. So what that means is you can come back to it whenever you have a chance. So the idea being, maybe you only have 5 or 10 minutes tonight, and then you can come back to it a week later and pick up where you started or where you left off. So you're not losing, you don't have to finish one whole module or you'll lose it kind of idea. You can move through the course at your own pace is what that really means. And then you can take the modules in the order that makes sense for you. So maybe you want to focus on tangible things like how to turn someone in bed. So maybe you take the module that's focused on that, versus maybe the module focused on advanced care planning you might do later on. So it allows you to move around to access the content that is really needed at the moment. How was it developed? So much like the Atlas CareMap, it was developed by taking an excellent resource that already exists and adapting it and scaling it across Canada. So this course is built off Champlain Hospice Palliative Care program up in the Ottawa area. And so it is a very well-respected in-person caregiver training program. And so we were able to digitize it so more people across Canada can have access. And there is a certificate at the end. So if, maybe you're an organization and you have people who are really supporting caregivers and you think this might be really great knowledge for them to get exposure to, they could take it and share their certificate with you. And just to sort of let you guys know, currently the course is only available in English at the time, or currently. So what does the course cover? So the course covers a variety of things, some things that are, more tangible, like I mentioned, turning someone in bed, to, conversations, right? So there's pieces in there around navigating the healthcare system, helping people sort of do their advanced care plan, what's their goals of care, how to provide personal care. So that's where we get into like hygiene, turning people in bed, that sort of stuff, the more tangible pieces. There is a module in there, or a section in there, on end of life care and medication management. There's a lot in there around communication. So whether you're advocating for the patient or you're advocating for yourself to get more support. So there's a lot of communication pieces in there. And then there's some self-care strategies as well, because often, again, as mentioned, caregivers kind of have their head down, and often they are the last ones that they think about. So we're going to move into sort of the last section of the webinar, which is going to look at really how can different people engage with the Care Connections program. So for instance, if you're a caregiver, one of the things is learn how to draw your Atlas CareMap. Really, that we've seen such great feedback around that. We've seen the Atlas CareMap get used outside of palliative care as well. But yeah, caregivers who have drawn their map have found it very beneficial. And then once the map is drawn, as a caregiver, really share it with everybody. Put your wish list on there and share it with anybody who asks how things are going. Pull that map out or open that picture on your phone and talk about it, right? It really will allow them and make it easier for them to maybe pick up some of the things that are on your wish list. You could certainly take the Leap Carers course. That will provide you with a lot of the knowledge so that you feel, a little more confident in what you're doing. And then, of course, we would love it if you could become a champion for the Care Connections program and sort of spread the word about it. So anyone who isn't a caregiver, but yet you want to support. So again, this sort of speaks to maybe an organization who has caregivers and you're wanting to do you're wanting to increase the support that you're providing them to a friend, a neighbor, a family member who wants to support a caregiver. So learn how to draw the Atlas CareMap so that you can help draw the map with that caregiver. Really, at the end of the day, the more work that's done by, say, a friend, the more successful the process is going to be, because often caregivers are tired, right? So if you learn how to draw that Atlas CareMap, you're going to become efficient at what needs to happen, and they just can simply answer your questions and you can help them draw the map. Host an Atlas CareMap community workshop. So I mentioned that toolkit a bit earlier. It's a free toolkit on our website, and it's got this slide deck, for instance, and the one that you'll see on Friday if you're attending. So it has everything there you need. It has a poster, it has invitation letters. Really, we provided all the content you needed to be able to host one locally in your community. Just download that toolkit and use the pieces. Certainly, you can take that Leap Carers course as well, right? So it increases your knowledge of, what kind of things are they facing, or, what sort of knowledge might they need, right? So you might be able to help them with that. So take that Leap Carers course as well. And then as well, become the champion about the Care Connections program. Help us spread the word about these free available resources. And then looking at the healthcare piece. So, if there are physicians or nurses, healthcare professionals on here who have patients that are caregivers, I really encourage you to take the healthcare module. Again, it's free, so that you can learn more about the CareMap, draw it, and then learn about, what does this mean within my practice? What can I do with this within my practice? And some of the things that you can do is, certainly promote it with your caregivers, maybe reflect on the map with them, that sort of stuff. And that knowledge you'll gain through that module. You could also look at hosting an Atlas CareMap. So we've had some sort of family health teams host Atlas CareMap sessions. And then encourage your patients to do the Leap Carers course as well, so that they can have a better understanding or find the information that they need to support them while they're on their journey. So we're getting near the end, and there'll be an opportunity for some questions, as we mentioned at the beginning, but we just really wanted to mention, so this is the Friday session that you've heard us referring to. So, really what we want to do on Friday is we're hoping to see many of you guys there, and we want to actually build the CareMap on Friday with you guys. So Nancy Marie and myself, we will be walking you through how to do that on the Friday session. So if you haven't already, if you're not aware of it or you haven't registered for it, I would encourage you to do so. I think the link for you guys to register will get dropped in the chat from the ECHO team. And yeah, please register and join us on Friday and really get an understanding of the building process. It will be a much more active session. You'll be working in little groups and things like that, talking about your CareMap. So there are two toolkits, and we just wanted to sort of give you guys a bit of insight on what's in these toolkits. So this Atlas CareMap toolkit, and that's the one where you're building. This would be the one, these documents would be the ones that you keep and you use when you're helping a caregiver build their CareMap, or you're a caregiver building your CareMap. So we've really got everything in here to support that process. We've got questions to sort of get you thinking about who should be on my map. And then when it comes to building that wish list, what are some of the things I wish I had help with? So we've got those questions to sort of help with the process. We've got a list of community resources. If you're realizing, oh, I could use support here, I wonder if there's anything in my community. And then we've got 2 documents here that are sort of conversation talking points that you can use when, say, you want to share your map with a family member or friend, or you want to take your map and show it to, say, your healthcare professional. Because we know sometimes like the talking can be, you know, a little nerve-wracking. So we really want to give you guys some talking points to help you share your map easily. And then what's within that workshop toolkit? Because of course, you know, we really are hoping many of you guys who are in the session today will host workshops locally. And certainly that's the foundation who support this session and Friday session. That's what they're sort of hoping for as well. And so that toolkit has everything from the first one, but then really it has all the other pieces you need to host that workshop: invitation letters, posters, funding request letters if you're looking for maybe some funding for coffee and tea and some snacks, including the PowerPoint with speaking notes. So this PowerPoint, much of it is in the community workshop PowerPoint. So we've really tried to give you everything you guys need. So you don't have to do a lot of creation. You just have to adjust, put the date in, the location, so that the process is much easier for you guys to host those workshops and become our champion for the Care Connection program. So sort of what are the takeaways today from our webinar, our session, is really the importance of social connection, and that it actually has a large impact on our health. And at the same time, strengthening those social connections also support a caregiver and strengthen their support network, which ultimately leaves them and the patient they're caring for, leaves them both with better quality of life. And sort of the Atlas CareMap is that main tool that we're encouraging the creation of, whether you're supporting the creation or you are a caregiver creating your own. And the idea that CareMap, one, it helps them understand what their caregiving journey looks like, and it's a visual piece. It also highlights their support network, so who's there already that maybe they can pull on again if they need to. And then it highlights opportunities for additional support if they create their wish list. And then just how can we increase those social connections, right? Like that's really, since we know it has such a large impact on people's health, how can we increase them? And so really drawing the map is the big piece here. So help caregivers draw their map, host a workshop. That's really going to help increase those social connections. So let's go back to the diagram we saw at the front, right? And let's sort of recap on why we need to create sort of a change, right? Why we need to really focus on creating those social connections to create an environment that's more supportive for caregivers and the patients. And, you know, as we saw here, when we looked at the last year of life, you know, this is 80%, and this is pretty much taken up by caregivers. So we need to fill this in, right? And create an environment that's taking on some of the work for the caregiver so that they just aren't managing so much. And that's really what we're trying to do here with the Care Connection program, right? So if we've got neighbors drawing that care map, if the care map's being shared, say with neighbors and families, all of a sudden people are picking up tasks that now the caregiver doesn't have to worry about and manage. So we start to then be able to, you know, fill in that 80%. Maybe it becomes 75 or 60% of the work is on the caregiver, but there's some tasks that are taken over by other people. So that's really what we're trying to do here, is we're trying to move from this, which is empty, to this, which is providing them with more support and also connection. So, you know, download those free resources, and we will share the location for these free toolkits and stuff in the Care Connection program and that Leap Carers course. But download them if you can, help people create their map or host those creation workshops. So if you're looking at how to access these free resources, it's the Care Connections program. This is what it looks like on our website. Maybe the Echo team could put the link in the chat, but if you go on to pallium.ca and you searched out the Care Connections program, I'm sure you guys would easily be able to find it. And then you can see all the different free resources within that program to work with. And again, hopefully we'll see many of you on Friday to actually sit down and work through creating a care map so that you guys have a better understanding, whether you're a caregiver or not, like what it is, what this care map looks like, and the reflection process, which will increase your, the likelihood of promoting these resources, running a workshop, that sort of stuff. Because we know sometimes it can be a little nerve-wracking, so we're just trying to reduce that. All right, does anybody have any questions? And I think we're hoping to do questions in the chat or the Q&A function, so not placing them in the chat, but putting them in the Q&A. I can't be that good that no one has questions. What do you guys think about the program? Maybe throw that in the chat. Like, what do you think about the Care Connections program? Do you think any of you attending the workshop on Friday? We'd love to see as many people as we can, of course, to attend that workshop. Let's see, we got a few new messages popping in. So Janet, are you attending the workshop? It looks like you are attending the workshop. Okay, we got another person attending. Great, awesome. We look forward to seeing as many of you as you can. It's a fun little activity. All right, I see a few more attending. I like it, I like it. Okay, guys, well, that's it. Oh, I see there's actually a couple Q&As. So Catherine, I'm just sort of looking at your Q&A piece. So happy to hear that you're going to be attending. And I love that you're hoping to incorporate this into your caregiving support work that you guys currently have. So that's really, really great. Someone said here, who in the Q&A, who is considered a caregiver? So, I mean, a caregiver is anyone who's providing care to either a family member or a friend. So it's really about that providing care. When we focus on caregiver, yes, we're not focusing on, say, like someone who provides paid care. So for instance, like a personal support worker, that's not necessarily what we mean by caregiver. We really mean, informal, unpaid, who's providing care to a family friend. Does that make sense? Does that answer the question? And in fact, in the first toolkit where you build your map, there's actually a document in there that defines a lot of this stuff, so that if there's any sort of clarity that needs to happen, you will notice that there is that document in there. So I saw in the chat, someone's asking if the documents of that one of the toolkits is available in paper form. It isn't, and it came out during the pandemic. So releasing it online just made the logical sense. But what you will notice in that first toolkit is the ability to draw your care map in a program. That Atlas of Care in the US, they've created a program, so you could draw the map there if you wanted to. But if you were going to host a workshop, yeah, unfortunately, you would need to be, going to Staples or something and printing off the pieces that you need. I will say the community workshop toolkit, it is designed for you to deliver in person or to deliver online. So we actually have like 2 streams in there. So based on how you're delivering, you would use this stream or that stream, because we know a lot of people are starting to get back together now and try and do things in person, which is lovely. So we have that option available in the community workshop. Awesome. So I don't see any more questions coming in between the chat and the Q&A. Oh, another one popped in. Anne, to clarify for you, so the Atlas CareMap is used broadly. So we've had people who, for instance, maybe have children with disabilities, and they use the CareMap to map their caregiving journey, and they update it as sort of changes might happen. So we have seen this content go more broadly than palliative care. Same with the LEAP carers. Yes, the course covers a lot of content, but really, if, say, for instance, you're a caregiver, but you're not on a terminal journey, at this time, you don't do that one module, but you can do all the other modules, advocating, turning someone in bed, advanced care planning, like all that stuff still needs to exist. You just wouldn't use that end of life module. So I wouldn't be surprised if our lead carers course is being used more broadly than palliative care. So I think, yes, quite easily, this content can be used more broadly. Hopefully that answers your question. Okay, I think that's all the Q&As and chat questions. So thank you everybody for joining us today. Nancy Marie and I really hope to see many of you on Friday to actually help build those care maps. You can just get a sense of what it's like. So we just have a couple more slides, and then you guys will be free to go. So of course, thank you for joining us. And to learn more about the Care Connections program, the link is there on the website. And I know as well, the ECHO team were great and put it in the chat a little bit ago. So that's where you can access the content. And there is a feedback survey. So we would really appreciate you to fill out that feedback survey as well for us. Because these ECHO sessions we run quite frequently, and we're always looking for ways to improve it. And that's it. So again, I'm hoping to see as many of you as possible on Friday. If you haven't registered, register. And if you're coming on Friday, you will get a welcome package with those documents, so you can get a sense of what they look like. And we do ask that you have a pencil and a piece of paper ready, because you're going to be drawing your own map. So we need you to be prepared for that piece. Nancy Marie, anything from you before we sign off?
No, great questions everyone asked. Certainly, I know we've gotten questions around the whole end of life thing, but I really do think that this is a great tool, especially for those that have joined from the email invite. I was talking about tools in your toolkit. For you, that this is an opportunity to learn about this information that you can share with your caregiver population. So I really believe that this is a great tool to help people live their lives, whatever that is, and have autonomy over living their lives. And thank you certainly to Heather for putting this together. Or sorry, for Bonnie. Heather was another I was on a Zoom call all day on Friday, so my brain is still kind of in there.
6.5 hours.
Thank you to Bonnie and to Pallium for putting this together.
Awesome. Okay, guys. So we will see you hopefully on Friday. And yeah, have a great day, everybody. So, grab the toolkits online, and yeah, hopefully we'll see you on Friday to build a map. Thank you.